Our news correspondent Zara King is here. So what else has the INMO found then, Zara?
Well, Colette, we've been hearing anecdotally probably since the depths of the pandemic that nurses and midwives and frontline workers in general, healthcare workers, everybody was kind of considering their future in the health service. But for the first time, we're really sort of seeing those figures being borne out. We can take a look at some of those figures now from the INMO. So they're telling us that 38 frontline nurses left a large Dublin hospital since January, but 12 of those were in the last month alone. So the timing of that is quite interesting. They also say the reasons given centre around the likes of the cost of living and safe staffing levels. So in terms of safe staffing levels, for example, in one emergency department, what would be deemed safe staffing would be 18 nurses on duty. In many cases, most shifts you were talking as low as 10 nurses on duty. So you're really realising the kind of impact of that. Finally, 64% the INMO say of new nursing graduates intend to leave the public health system. That's a huge number, 64%, Colette. Now, in terms of what exactly happens next, well, look, Phil Hay from the INMO was saying it's all well and good saying recruitment is underway, but retention is a key issue in the health service right now.
We're saying to the HSE and the Department of Health, retention is as important as recruitment, because you're actually just pouring water into a sieve by recruiting into an environment that's going to force people to leave. We are now admitting on a daily basis we are not meeting the safety standards. We don't have enough nurses to meet the safety standard. Likewise, in midwifery, we should have one midwife for every 29.5 births. We're way outside of those parameters, so that's unsafe. So I think the general public need to support our call for legislation to make sure that when you go into a maternity hospital or a general hospital, that the levels of staffing is safe, because currently it isn't.
So, Colette, look, Phil Hay is very clear in saying that the level of staffing is not safe, that nurses are under enormous amount of pressure. We were speaking to and heard anonymously from a number of nurses today. I want to take you through some of what we heard. One said, I'm working in a major Dublin hospital with 7 years experience. I have never seen it so bad. Another said, it's hard to keep going. Morale is at an all-time low. I work in a specialist role, but feel like I'm leaving. I have very little support. Longer one here, a nurse with 6+ years, varied experience, come home to answer Ireland's call, as a lot of people did. I can't get a mortgage, no quality of life with my shifts. I just got a visa to go back to Australia. I cannot see myself ever nursing again in Ireland. There is a mass exodus. So that's the reality of what we're seeing, Colette. Phil Hay is warning today that countries like Canada are coming to Ireland and they are aggressively recruiting nurses from Ireland. Now, the HC will say that there are a number of highly qualified people who are looking for experiences abroad, but the reality, the INMO says, that if the working conditions in Ireland were much better, they wouldn't be running away so fast.
All right, Sarah, thank you.